Good day, and thank you for joining today's virtual event. I am Sherilyn Francis with the Optimal Health and Wellness Clinic, where we treat the underlying causes of disease. We invite you to connect with us via social media at OHWC_MSM. At the Optimal Health and Wellness Clinic, we offer an integrative care approach to chronic disease management. The four pillars of the clinic are plant-based nutrition, stress management, physical activity, and sleep hygiene. The treatment goals of the Optimal Health and Wellness Clinic are to prevent new chronic disease, to reverse existing chronic diseases, decrease the need for multiple medications, to reduce the incidence of adverse drug reactions in sensitive patients, and to improve outcomes when patients are non-compliant with medications. And now a few housekeeping measures. As participants, your microphones are muted and shall remain muted through the duration of the webinar. We ask that you refer all tech issues to the tech support chat pod, and all questions for the presenter shall be referred to the presenter Q&A pod. There will be periodic stopping points for question and answer, and there will be time designated at the conclusion of the webinar for discussion and questions. Additionally, we invite you to continue this dialogue by joining the Optimal Health and Wellness Clinic virtual learning community. Following this webinar, you will receive instructions on how to join and access this virtual space. I now present to you today's webinar entitled An Integrative Care Approach to Stress Management, presented by Dr. Ruby Thomas, Assistant Professor, Department of Community Health and Preventative Medicine, Morehouse School of Medicine, and Dr. Kofi Kondwani, Assistant Professor, Department of Community Health and Preventative Medicine, Morehouse School of Medicine. The objectives for this webinar are to determine how stress can impact mental and physical health, appraise stress management techniques for patients regarding various diagnoses, and to evaluate the impact of meditation on health and wellness. As you enjoyed today's webinar, we invite you to keep this client perspective in mind. The overall benefit of stress management is being able to unplug. And now, Dr. Ruby Thomas.
So basically, I just wanted to cover what the stress response actually is, both physiologically and how that affects the body, as well as how the relaxation response that Dr. Kondwani talked about, which you can achieve with the consciously resting meditation, counteracts the stress response. So if we define stress, it's defined as a state of threatened homeostasis to the body, and this can follow exposure to either an intrinsic adverse force or an extrinsic force. In old days, in prehistoric time, those stressors were more overt, so it might have been a predator, it might have been adverse weather conditions that affected the safety of you or your family. These days, the stress is more technology related. We have socioeconomic stressors. We have, with everything going on in the news, we have stress from the fears of attacks and things like that. We have constant access to email, telephone access, and things that are hard to shut off. And being in the medical profession, we have additional stressors related to that work as well. So the actual stress response is a physiologic response that your body creates to these stressors. It's also known as the fight or flight response, and it enhances your attention, increases your cardiac output, increases your respiratory rate, redirects blood flow to your muscles. It's prepping your body either for a confrontation where you'll have to fight to defend yourself or your life, or to flee that situation. So your state of arousal is upregulated, you're more vigilant, you have more focused attention, and those functions that are not essential for that fight or flight response, so like your digestion, your growth, your reproductive system, those things are essentially shut down. The fight or flight response is mediated through essentially two sets of hormones, if you think about it that way. One is cortisol, which acts to the hypothalamic pituitary axis, and the other is epinephrine and norepinephrine, which works through your sympathetic nervous system. Now, if we have this response in response to an acute event, like such as an attack or response to a predator, is fine. But what's happening now is that this response is chronically turned on in response to many of the things that we face in society today. And that's where the adverse health effects come into play from that chronic stress response. So we see with cortisol what happens hormonally in the body is it shifts the body towards this catabolic state. So you're making glucose from the liver, you're increasing your circulating glucose levels, you're breaking down fat or protein, which are your energy stores, because you're getting prepared to fight or to run. And then your growth hormone, your insulin, your thyroid hormone, those things are essentially shut down, as well as your sex hormones. And the adrenal system essentially does the same thing. It makes changes to your body that impair your glucose tolerance and increase the risk of acute cardiovascular events such as heart attacks, and stimulates the release of glucose, and your body basically makes the energy that it needs to fight or to run. As a result of that, you see we get increased glucose production. Other things such as insulin production have shut down, so that eventually over time, if this response is chronically activated, like it is in many low economic underserved areas, you get a lot of physiologic changes that you see with metabolic syndrome. You get obesity, you get increase in triglycerides, LDL, and get decreases in HDL. You get decreased lean body mass and insulin resistance. The stress response may also affect the immune system, so that may put people at higher risk for getting infectious diseases. And then psychosocial stress alone is a major independent risk factor for high blood pressure and cardiovascular disease. And the signs and symptoms of stress can vary. They can range across a wide array of symptoms. They can be emotional, they can be physical, they may mask as other conditions such as depression or anxiety. They may have physical manifestations such as headaches, back pain, stomach problems. Essentially anything you can think of can be a sign or a physical sign or symptom of stress. So how do we recognize stress in our patients? As healthcare providers, it may behoove us to think of it really as another vital sign when we're thinking about our physical exam. So these are two examples, and hopefully these documents have been uploaded so you can access them. But these are two questionnaires that may be helpful in assessing your patient's stress levels in the office. There's the Holmes-Ray Life Stress Inventory, which basically looks at life stresses in the past year. So this looks at major stressors such as the death of a family member, loss of a job, birth of a baby, having to relocate and things like that over the past year. And it gives you a number or a level. The perceived stress scale looks at how a person perceives their stress level in the past month. So it asks a few questions. It's like one page about how they felt in the last 30 days. And if you see a patient over time, you can use these questionnaires to sort of gauge where their stress is and how that's affecting their health in the office. So the other side of the coin from the stress response is the relaxation response. And this is a state of relaxed positive attention, and it's usually to a repetitive or absorbing stimulus. And it helps turn off sort of the inner dialogue in the body and helps deactivate the sympathetic nervous system. So it's the opposite of fight or flight, and it results in the opposite effects. So you get decreased metabolism, decreased heart rate, decreased blood pressure, respiratory rate, and slowed brain waves. And Dr. Kondwani talked about this a little bit, but you're brought to this state by creating a non-judging receptive awareness. And it's usually brought about by focusing on a repetitive thing, such as a word, a phrase, a prayer, or an image. And like I said, it counters the harmful effects of the stress response and can result in muscle relaxation, a quieter mind, less negative emotions, more positive emotions, and promote a state of learning and enhance creativity as well. So there are several techniques to elicit the relaxation response. Dr. Kondwani talked about meditation, but there are other methods as well, such as biofeedback, which trains people to improve their health by controlling involuntary processes such as their heart rate, blood pressure, skin temperature, and muscle tension. And in this, individuals are usually hooked up to a computer or a monitor where they can see their vital signs, such as their heart rate or their respiratory rate, and try to control their thoughts and their breathing and see how that affects their somatic vital signs. There's also clinical hypnosis, which is different from the typical hypnosis that many people think about. It's really just a state of focused attention, and the result is an altered state of consciousness, which is typically a more relaxing state. Guided imagery is sort of like directed daydreaming, where you're visualizing something, but the purpose is to help support health and healing. Autogenic training is another method to elicit the relaxation response. It's essentially a daily practice of repeated practices that induces a state of relaxation. So progressive muscle relaxation would be an example of that, where you basically go through from head to toe and contract and release different muscle groups, and this leads to that state of relaxation. Sometimes the relaxation response can be coupled with physical activity, so you get two benefits for the price of one. So in activities like yoga and Tai Chi or Qigong, the goal is to, yes, do some physical exercise, but by doing this exercise, you do also elicit this relaxation response. Any repetitive physical exercise can do it as well, and then prayer and meditation as well are also techniques. Coloring has gotten a lot of recent interest. It's very popular. There's a lot of marketing around it. You see coloring books in every store now, and it's being touted as a relaxation technique to help adults relieve stress. And there are a few studies that show that, this one in particular showed that coloring mandalas, which are basically these circular pictures with a repetitive pattern in it, can help reduce anxiety levels, and this was done in undergraduate students. But it does, by coloring the repetitive pattern, it does help induce a state of relaxation. And this is a low-cost and potentially effective way to help people relax. To grab a coloring book, you can even you can print these mandalas out on the internet and even put them in your waiting room with some colored pencils if you'd want to help your patients relax. So there are a lot of resources out there, a lot of websites, and a lot of apps that can be useful to refer yourself or even patients to help find meditations or other things that may elicit the relaxation response. There's the Center for Mind-Body Medicine. The Ohio State University has a lot of good resources, and there are a lot of apps. The Healing Buddies Comfort Kit is one that is especially designed for children, so if you're seeing a pediatric population, that may also be helpful. Okay, and that's it for me. If you have any questions, I think we will take them now.
Okay. Now, the mind can either be conscious or unconscious. When it's conscious, it's awake. It's aware of what's going on around it. When it's unconscious, it's unaware of what's going on around it. At the same time, the body can be active or it can be at rest. So if there's two ways that the body operates, two ways that the mind operates, there should be four distinct experiences you should be able to have as your mind and body interact together. Now, when the mind is conscious and awake and aware of what's going on around it, and the body is active, that's the waking state of consciousness. That's what we're all in now. Now, when the mind is unconscious, unaware of what's going on around it, and the body is resting, we're sleeping. Also, when the mind is unconscious and the body is active, we're dreaming. There's the random eye movement that's going on. The body is healing and working to rejuvenate itself. So these activities in the body occur, and it also causes activity in the mind. But you're unconscious, so they're called dreaming. So waking, sleeping, and dreaming, this is what we're used to having to some degree every day. Waking, sleeping, and dreaming. But where is that part of our day when the mind is conscious and awake and aware of what's going on around it, but the body is resting? The heart rate has slowed down. The breathing has slowed down. There's changes in skin resistance, changes in blood chemistry, changes in brain waves even. So that's a different state of consciousness as your mind and body relates. So this is called consciously resting. The mind is awake, the body is resting. You're not dreaming, you're not sleeping, and you're not just awake. So it's a fourth state of consciousness, and this is what I based consciously resting on. The ability for anyone to naturally set up the conditions to allow the mind and body to settle down, to experience deeper levels of itself. So consciously resting is a way to reduce stress. The person that determined or created the word stress, his name was Dr. Hans Selye, and he said that you can get as much stress from a passionate kiss as you can the lash of a whip. Now, in my case, if that was a clinical trial, I know which group I'd want to be in. But at the same time, what he's trying to say is you could be told you won the lottery and have a heart attack and die. So it's not only bad things that can cause stress in your body and in your mind, but even good things can cause as much and sometimes even more stress. So don't look at stress as something that's only negative, but it can be positive as well. So consciously resting is a state of profound, deep peace and calmness that you experience, yet your body is resting as if it was sleep. In fact, your heart rate reduces about 20% or more during the period of consciously resting, when at night your oxygen will only decrease about 8% over an 8-hour period. So if you use oxygen as a gauge for being able to get a deeper rest, then it shows that it's much deeper during that short period of consciously resting as opposed to even just sleeping. So oftentimes we sleep, we have our pillow, everything is comfortable, but sometimes sleep will come when it comes. So you may remember this in one of Chevy Chase's movies where everybody in the car was asleep, including the driver. When it's time for sleep to come, it will come because your body has to have it. And if we don't give ourselves the rest that it needs, the body will take it one way or the other. So I want to go over a few of the clinical trials and the studies that I've been directly involved in, starting way back in the 80s in Oakland at the West Oakland Health Center, where we took about 60 or so African Americans that were hypertensive, either on medications or off of medications or never been on their medications. And we randomized them to learn either meditation, progressive muscle relaxation, or a health educational control group. And what we found in this study was that after 3 months of practice, there was an increase in the educational control. There was a decrease of about 6 millimeters systolic blood pressure in the progressive muscle relaxation group. And the meditation group, transcendental meditation group that I taught, actually reduced their blood pressure about 11 points, their systolic blood pressure. Now, this is comparable to some medications. If a person was borderline, as they would say, hypertensive, then just starting this natural approach to reducing the stress could also reduce the blood pressure, as you can see here. But not only did the systolic blood pressure change, but actually diastolic blood pressure changed as well. About 6 points in the meditation group compared to about half that for the progressive muscle relaxation. And the educational control actually had an increase. So these are people who only got materials in terms of what they should do in terms of diet and exercise and getting relaxation. So then I said, okay, great, blood pressure is reduced with meditation, but what happens to the heart itself? So I was interested in the left ventricular mass to see if there was a change in mass as a result of meditation compared to a health education control group. And what we found that there was a reduction in both groups in terms of left ventricular mass. That LVI is left ventricular mass index, indexed by the body surface area. So we found there was a significant reduction in both groups. But when we looked at the psychological parameters of the people in the group, we found it was very different in the meditation group compared to the control group. The meditation group had an increase in energy and positive affect. They had an increase in emotional control, and they had a decrease in anxiety, depression, sleep dysfunction, and physical symptoms of distress. So that occurred in the meditation group, and there was no such changes in the control group. In fact, some things actually got worse. So at Georgia State University, here in Atlanta, Georgia, I went there in the Counseling and Testing Center at the university and proposed that we introduce consciously resting meditation to the freshman students there, as well as see students that come into the Counseling and Testing Center for different reasons. Some come to see the psychiatrist or social worker or psychologist. Some come for the nutritionist. Some come for other complaints. Oftentimes they're referred when they're in academic difficulty or actually on probation for behaviors such as drinking on campus or other behaviors that break the rules and cause problems. So in going there, I taught about 1,500 students meditation over the last 3 years. And what we found in this first question that we asked them after they learned meditation the first time was that they noticed a change in breathing. And 95%, almost 96% said their breathing slowed down. Now, as I said before, you can relate your physical activity with your oxygen consumption. So the more active you are, the more oxygen you need. And the less active you are, the less oxygen you need. So during the practice of consciously resting, out of these 1,500 students, 95% noticed their breath rate slowing down. Their breath rate slowed because their thinking slowed. So consciously resting is a process of reducing the mental activity. And when the mind slows down, the body slows down. And when the body slows down, it wants to heal. It wants to purify. It wants to get rid of the stress and the fatigue in the system. So this is what we found immediately when people learned meditation. This was in the classroom setting, about 20 students per classroom. These were all freshmen coming into Georgia State. When we asked them a question, the students, were there any time during the meditation where you were unaware of your body and surroundings? That means that their body was so quiet and their mind was so quiet that they lost track of what was going on around. The noises, the sounds, different things that would normally interrupt. And you see, half the people had that experience of being unaware of body and surroundings. When you're unaware of body and surroundings, you're also unaware of thoughts. You're also unaware of pain. You're also unaware of stress. You're just quiet. You're just at peace. When we ask the students, do you remember any moments when there was no sound or no thoughts in the mind? And over half of these students, so that's more than 750 students out of the 1,500, had that experience of no sound and no thoughts. Yet they were not asleep. So how often have you had the experience of sitting quietly and experiencing no sounds at all and having no thoughts at all? So it's a rare experience. And when it happens, if you don't have a process to repeatedly allow this to happen, then you'll find that it worked one day, and then the next day maybe you couldn't get to it, and the next day it worked, and the next day it didn't. But this is a process that each time you sit to quietly consciously rest, that you'll have these experiences of reduced thoughts in the mind. So this asks the students just simply, how did they feel before they learned meditation that day? So this is within 1 hour. And how did you feel after you learned meditation? And you can see the blue line indicates before they learned meditation. This is a Likert scale. 1 is relaxed, 5 is stressed. So before they learned meditation that day, they rated themselves as being very stressed. After they learned meditation, immediately after, they rated themselves as being much more on the relaxed level. And this is all within an hour or less. So you can see there was a significant impact immediately on perceived stress of the people who participated in this evaluation. Now, when I taught consciously resting to the students in Georgia State, I saw them on one class period, and 1 week later, I came to their second class period immediately. So between the time they learned consciously resting and 1 week later, I gave them a home rest assignment. Now, most of the professors that they have, probably all of the professors, will give them homework assignments. My assignment to them was to have 2 20-minute sessions of consciously resting each day between the day they learned meditation and the week after they learned meditation. And then come back, when they came to class, I asked them to write a 1-page reflection of their experiences. So I have 1,500 reflections of students' experiences of 1 week of meditation. Some were more consistent than others. If they got all their meditations in, they would have had 14 experiences at home on their own, or wherever they were. They could have been out in the park. They could have been sitting, not driving, in their car. They could have been sitting on the bench, sitting at the library, sitting in the hallway in class. So they could meditate any matter where. It's helpful if it's quiet, but it's not, quietness is not even a requirement, because you learn how to deal with thoughts in the process of meditation, where thoughts are no barrier to meditation. So when we asked the second week, do you feel more like resting, or do you feel more energy after the meditation? So most people felt more like resting, although quite a few people, over 400 people, felt more like they got more energy to do the things that they need to do. But those that feel like resting, they probably have a sleep debt that they owe their body. And until they pay that debt back, their body is going to want them to continue to rest. After they receive the rest from the meditation, then they're going to begin to get more and more energy. When we ask them, after a week of meditation, have you noticed any indications of increased clarity of mind? So out of the 1,200 people that filled out the post questionnaire, 65% of those people said they've noticed their minds were a little clearer. Now, for a student, that's very valuable to have a clear mind. That's what you need to remember what you read, to be able to discern what you need to do for the exam. A clear mind is precious, but not only for the student, but also for the faculty, also for healthcare providers, also for patients. Everyone needs a clear mind in order to do the things that they want to do, because then there can be less stress because they're making better decisions. Also, we ask, have you noticed any change in your sleep quality? And of the 1,240 respondents, almost 60% said they noticed a change in their sleep, that they went to sleep faster, that they slept longer before they woke up. They had fewer interruptions during their sleep, that they woke up more refreshed. These are the things that they're commenting around their sleep. So if they're getting a better quality of sleep, then their mind is going to be clearer in the morning. A lot of people, when they wake up, they're still not refreshed. They're still groggy. They still prefer to be back in the bed. But this is an opportunity where they can get a deeper sleep and be more effective and more productive during the day. Again, we ask the same questions. Instead of how did you feel before you learned meditation and how did you feel after, this time we ask them, how did you feel a week ago compared to now? A week ago, they rated themselves, again, more on the side of being miserable. And for now, for that day, from the follow-up, they rated themselves to being more on the relaxed side. So they're feeling the difference in the meditation. Once they got it, they got it. Most of these 1,200 students, I'll never see again in my life. But they have a tool, a strategy that they'll be able to use for the rest of their life whenever they feel that they need to, or even as a preventive strategy to keep the stress from coming onto the system. You want stress to impact your body like water on a duck's back. You don't want it to get inside and underneath the feathers. You want it to just roll away. Stressors are, but people respond differently to stress. So there's people here at Morehouse School of Medicine that loves working in the emergency room. For me, that's stressful. I would not do well in the emergency room, and I knew that. So I knew I had to take another approach to contribute to the health of and the public health of people that I care about. So this was the approach that I've taken to share a simple mental strategy that could help a person settle the mind down. And as the mind settles, the body settles. And when the body settles, it wants to heal and purify and get rid of the stress, get rid of the fatigue, and help the mind be clear and focused and help you be able to do what it is that you feel that you need to do and have the energy to do. So this is consciously resting, a simple process. We can go into how it's done later if you like. We'll also have a question in the questions to you asking if you would like to learn consciously resting meditation, because it's something that can be taught online as we are now. There would be some different parameters that we would seek for you to do in terms of setting up your environment and also your physiology before you actually learn meditation. For instance, you wouldn't go into meditation after you've eaten a large meal, because your body is actively digesting the food, so you won't be able to settle down as much. So we kind of go over those things and prepare you to learn, make sure you're in a quiet environment. But there's no reason why you could not do the same thing that I do when I'm interacting with people one-on-one or in small groups. The same thing can be done online. So I'm going to start online.
So we have a few questions. One question is, are insurance companies covering any relaxation and stress management techniques?
I don't think they're Yes, I'll address that. I don't think they're covering them explicitly right now. There is language in the Affordable Care Act that is looking at having some language with insurance companies and increasing reimbursement for integrative medicine practices. It's more along the things like acupuncture and things like that that are more procedurally oriented. But I don't think there's anything explicitly covering stress management with insurance that I know of.
And you know, that's unfortunate, because if you can deal with the stress before it solidifies and turns into hypertension or a stroke or heart disease or some other issues, that would be much more better for the person. But the system is not set up for prevention. It's more for treatment, and that's a big problem.
I agree.
Okay, so next question, how long does the education take for meditation?
The process of learning consciously resting, it's 2 1-hour sessions, about a week apart, to give you time to practice individually on your own, because it's about you as an individual. It's not about a group. It's not about the teacher. It's about you understanding simple principles, like riding a bicycle or swimming. Once you learn how to do it, you got it. And once you got it for the rest of your life. So just learning it is in the first session. And then once you practice it on your own for a while, we come back and discuss it. And just see how you're doing, how you're implementing it, where you're implementing it, if you have any issues, if you have any trouble with thoughts, or so we just kind of help you integrate the process into your regular routine. But 2 1-hour sessions, I feel, is sufficient for most people to grasp the principles of consciously resting.
Okay, we have a question from
Oh, I'm sorry. I wanted to say the effects of the relaxation response, the benefits definitely take time to occur. So it's not something that a person would, do once and feel the benefit of. It definitely needs, like Dr. Kondwani said, practice and repetitive practice to elicit the health benefits.
Okay, thank you. So we have another question from Kayla. Can someone learn CRM online?
Absolutely. Because it's not about charisma or sitting in front of people and giving them the environment for the meditation. The meditation is a personal thing. And once you learn the simple processes that facilitate establishing that relaxation response, then you're done. You got it. So it doesn't take long. It can be done online. I've had several webinars where I've taught meditation to people in different parts of the world at the same time, including India. So it doesn't matter where you are, and it doesn't even have to be online. If you had a CD or some information just taking you through those steps. It's hard to read and do it because you're supposedly doing it with your eyes closed. So if you're trying to read steps and go forward, it's cumbersome. It may or may not work. The simplest way is to get the specific directions, whether it's online, whether it's in person, whether it's over the telephone, and then follow those directions, and you'll have that experience. And then you'll be able to repeatedly have it for the rest of your life.
We have a question from Hillary. Is there a difference between transcendental meditation and the type of meditation discussed by Dr. Kondwani?
Yes, that's a very good question. And my training in meditation, official training in meditation, was at Maharishi International University in Iowa. So I learned to teach transcendental meditation many years ago as part of my PhD program. However, transcendental meditation is taught individually. There's some cultural components to it. It wasn't conducive to learning in the community, from my opinion. I wanted to be able to teach groups instead of individuals at a time. And so this, at the process at Georgia State, I was evaluating being able to teach individuals in the group, which would be much more cost effective than teaching one person at a time. And what I found with consciously resting, that it is conducive to group learning. Therefore, classrooms, people online can learn it in a more simplified way.
Dr. Thomas, we have a question for you. What would you say to providers who are interested in improving the health and compliance of a patient, but they don't have questions about the benefits of the brand care?
I'm sorry, can you repeat that?
So yes, I can. What would you say to a provider who is interested in improving the health and compliance of a patient, but may have some questions about the benefits of this brand of care?
I would say to the provider to be your first patient. Honestly don't think we should recommend anything to our patients that we're not willing to do ourselves. So If you have questions about the benefits, if it works, if it'll be helpful, try for yourself first and see how it works for you. If you find benefits to it, use it. If not, find what works for you. But I definitely would recommend any provider, especially with the highly stressful job of being a physician, to find some technique of relaxation or stress relief that works for them. And once you find something that works for yourself, to share with your patients and your community.
Thank you, Dr. Kondwani. We have a question regarding your Georgia State study. Will you be conducting this study in the future on non-student participants?
Well, I've done work. See, the question is, where do people gather? And that's all I need. So I've taught meditation in churches. I've taught meditation in prisons. I've taught meditation in high schools, elementary schools, colleges. So it doesn't matter the group. It doesn't matter their level of education. Only thing matters is that they sit in a chair comfortably and willing to experience deeper levels of their own mind. So oftentimes when I sit with the group, I have, there's really not much in common with the group. They've come to hear about meditation from different areas. So it doesn't matter if they can understand English, and it can be taught in any language, but I only can teach it in English, but I have taught through translators as well. That's all that matters. So a group, a small group, an individual, literally it can be 1,000 people in the room, and they can all go through the process at the same time, and they will all have similar experiences as we found at Georgia State. And that's the beauty of being able to translate this into something practical, something that many millions of people could use at will. Just picture it as a part of a school system where the whole school stops and meditates for 10 minutes at the beginning of the day or in the early afternoon. It would make a difference in the school, and that's what we found at a school here in Atlanta, elementary school, where I taught 350 students meditation. From kindergarten to the 8th grade. So it doesn't matter who the audience is or where the audience is, because the process is mental. And once you go inside your own mind and employ the principles that are discussed in consciously resting meditation, then immediately you'll find those, not only the psychological benefits, but the physiological benefits.
Next,
Was I muted?
Next, we have a question for both Dr. Thomas and Dr. Kondwani. Have you noticed cultural differences in the effectiveness of meditation? Do some cultures or people respond better to meditation?
Go ahead.
That's a wonderful question. If I can start, Dr. Thomas.
Go ahead.
There are differences in people's perceptions of what meditation is. Even though they are thinking in whatever language they have or whatever culture, they still think. They still have lots of thoughts. And once they reduce the number of thoughts that they have, their mind becomes more and more clear. And when the mind slows down in the thinking, the body will slow down. So it doesn't matter what language or what they believe. A lot of people will relate meditation to religion. But I ask them to consider meditation as listening and prayer as speaking. So it's two different approaches. But if you're going to have a conversation with the Creator, you not only want to talk, but you want to listen. So particularly in the African American community, there was this misunderstanding that meditation was this negative thing. But now those same people are saying, if you can teach my son how to be still for 5 minutes, I'll pay you. Or if you can slow my daughter down. So it's a different, stress is so overwhelming now that whatever methodology people can come up with to settle that stress and reduce that stress, where you're not taking drugs and where you're not doing something harmful to yourself or to others, where it's just a simple, natural process. That's what people are looking for. And I think more and more that's going to be what people use to prevent themselves from getting the diseases and the stress and the problems associated with it.
Yeah, I agree. I was just going to say, I think, the cultural difference is in how the different groups of cultures may get to that meditative space or that relaxed space. For some people, it's just being in deep prayer for, however long before they can relax their mind. And, it's essentially the same effects as meditation. For some, it's maybe a dance will get them to that space. So I think it's just the cultural difference is how they get to the relaxation response.
Thank you, Dr. Thomas. We have a question for you. How do you believe stress management would help providers, and is it something that you would recommend / require for providers to experience because they are under so much stress?
Definitely, I would recommend that everyone, especially, physicians, healthcare providers, experience it because we just work in such fast-paced, high-stress environments a lot of the time. And I think it's a way to sort of help ourselves reset. And once we reset and clear our minds, we'll be better able to focus on helping the patients or giving them what they need without, I know I speak for myself, without that air of feeling hurried or frustrated during the day. So, just taking a few minutes, a few times a day to take some deep breaths and recenter, I think is an important skill for anyone in a high-stress environment, especially healthcare providers.
And not only healthcare, but first responders, police, fire, emergency medical people. It's so, with this problem, this situation down in Orlando, they had this morning a group of the physicians that were taking care of all of the wounded coming in from Orlando. And just the amount of stress that they were under and how they went for 24, 30 hours straight before they could stop and rest themselves. They need to have ways, because if they can't get rid of the stress, then it becomes a disease within their own bodies. And then they're not useful to anyone. So if you don't protect yourselves as healthcare providers, then some of these things that people bring to you may become you. And that's very dangerous. And the life expectancy of healthcare providers is not the same as the people they take care of because of the stress.
We have another question from Hillary. Have you explored coupling meditation with medicinal marijuana in an effort to further the meditative experience?
Well, that sounds like a research study. It wouldn't be my interest in that area because the meditation experience itself is one of decreasing thinking. That of drugs could be actually increasing thoughts. So your mind becomes more active. It's a stimulus. It's like drinking coffee. You drink 2 or 3 cups of coffee and then think you're going to sit and have a calm meditation. It's not going to work because you're going in 2 different directions at the same time. So if a person wants to have the meditative experience, the one that I describe as becoming less and less active mentally, then anything that stimulates that thinking will be taking you in the opposite direction. If you decide that you want to do that, that's kind of up to you and up to the state that you live in. But I would not mix the two.
Dr. Thomas, did you want to share a perspective on the topic?
No, I agree with Dr. Kondwani.
Okay, we'll move on to the next question. PTSD and CTE are results of brain injuries for military personnel and football players, respectively. How do you believe meditation would benefit that audience?
I feel first, if you can prevent the trauma, that would be best. Now, when I first learned meditation, the reason I started was I saw research that showed that you get faster reaction time from meditation, that your reactions improve. And I was studying martial arts, and I was basically getting my butt whipped. And this was my method to try to reduce that. And I did find that my reactions were better, and I was able to anticipate more, and I reduced the numbers of feet in my face over time. So reaction time is important. So the meditation has been linked to better reaction time. But it also has been linked to PTSD and the ability to reduce those symptoms of post-traumatic stress. If you get stress on you by doing something, you have to get it off of you by resting, by getting a deep rest. So the deeper the rest you can get, the more you can release that stress from your system. So it can be a preventive strategy as well as a treatment strategy for stress and traumatic stress.
Yeah, I believe there's probably more data out there about how meditation can affect or help PTSD. With CTE, I'm sure that's a great area for a potential study. I know there's still a lot that's unknown about that process, but I would think that meditation could help with some of the instability, the emotional aspects of it as well. That's also a good research study.
Do we have any more questions from the audience? Oh, we do have a question from Sherry. She would like to know, how does she sign up? So I'm presuming she's referencing signing up for the virtual meditation session.
Well, I think there's a question on the evaluation, whether you would be interested in a session. And the people here at the Optimum Health and Wellness Clinic will coordinate a session where you'll actually learn the meditation, that we won't talk about it as we're doing now. It won't be so didactic, but it will be a personal experience. So be sure to indicate that on your evaluation, that this is something you would be interested in. And we're thinking about sometime in the fall that we would make that available to participants.
Thank you, Dr. Kondwani. Do we have any more questions from the audience? Yes, slides will be available. They will be emailed and provided within the virtual community. Any more questions? Well, thank you, Dr. Kondwani and Dr. Thomas, for an engaging and educational presentation on stress management techniques. Again, and thank each of you webinar participants for attending today's webinar. You will be receiving a post-evaluation via email and the webinar playback video in addition to the webinar slides. Thank you and have a wonderful day.
Thank you.